Hello everyone, thank you for having PHARMA KNACK. Today we are going to discuss about a very important topic, that is histamine receptors. We have four histamine receptors, that is H1 receptors, H2 receptors, H3 receptors and H4 receptors. H1 receptor is responsible for allergic inflammation. H2 receptors helps in the secretion of gastric acid. Then H3 receptors help in neurotransmission and H4 receptors is responsible for immunomodulation. Now let's focus more over H1 receptors. So when the histamine got bind over the H1 receptors, there will be a increase in IP3 and DAG. So IP3 is a secondary messenger and DAG, that is diacyl glycerol, is a signaling lipid which will lead to the influx of the calcium, and increased calcium will lead to the activation of protein kinase C. So increased protein kinase C will lead to the activation of T lymphocyte. T lymphocyte then produces cytokines which has an ability to recruit macrophages and other inflammatory mediators, which will lead to the allergic inflammation. And the alternative mechanism where the allergic inflammation is caused by the H1 receptor is that while histamine got binded over the H1 receptor, PLP-A2 got activated, and which will lead to the increased secretion of arachidonic acid. As we all know that several enzymes are present in our body which has the ability to oxygenate arachidonic acid, and it will lead to the formation of several inflammatory mediators, and eventually it will lead to the allergic inflammations. So this is how an allergic inflammation is produced in our body while histamine got attached to this H1 receptors. Now let's focus over the distribution of H1 receptor in our body. The H1 receptor can be found over B cells and T cells, that is B lymphocytes and T lymphocyte. Then vascular smooth muscles, it can be found over nerve cells, eosinophils, monocytes, airway, then neutrophils, then epithelial and endothelial cells and hepatocytes. So these all are about H1 receptors. So we will be discussing H2, H3 and H4 receptors in our coming videos. And so that's for today. Thank you.